As word spread of new variants of COVID-19, calls grew for greater restrictions on travel. That's resulted in the implementation of new measures to try to catch cases of COVID coming into the country. Is it enough, too little, too late, or too much? With us to consider that, we welcome from furthest away from our studio to closest, in Burnaby, British Columbia, Kelly Lee, Canada Research Chair in Global Health Governance at Simon Fraser University and lead of the Pandemics and Borders Project. In Castleman, Ontario, just southeast of Ottawa, Dr. Paul Roumeliotis, Chair of the Council of Ontario Medical Officers of Health and the Medical Officer of Health and CEO for the Eastern Ontario Health Unit. And in Ontario's capital city, Frédéric Demanche, Director of Ryerson University's Ted Rogers School of Hospitality and Tourism Management. Hello to you all. Thank you so much for being here on the show. This is probably the latest hot topic in the age of COVID. To get into our conversation, I wanted to get from all of you one or two sentences of how you feel, how you would sum up your top concerns with the current travel restrictions that are in place, either at the federal or provincial level. Kelly, I'll start with you since you're the furthest away.
Yes, hello. Well, my main concerns with the current measures is that in terms of public health risk management, they're really a patchwork of partial measures which fall short of what we've seen that works in other countries. So the HAP measures announced a few weeks ago and not even implemented yet is the equivalent of locking your front door to the virus but leaving your back door open.
And Dr. Roumeliotis, I'm going to call you Dr. Paul because that's how a lot of people call you. What would you say?
I would tend to agree that we are faced with both international border travel issues, but also interregional, more close to home, and so I do believe that there could have been stronger measures put in earlier, and we are struggling at the local level for even interregional travel restrictions or concerns, particularly now with the variant in play.
Frédéric, there are concerns that we might go into a third wave. We're almost out of the second wave. What would you say are your top concerns?
Well, the top concerns, like my colleagues indicated, is the lack of consistencies in the measures that have been taken in the past months. So that's one thing. But also, I have to say, a top concern is the economic viability of the travel and tourism sector, the airline sector that have been hit more than any other sector in the past few months. And that has a tremendous impact, not only economically, but also socially.
So would you say that you don't think that they should have the travel restrictions for that reason?
I'm not saying they should not have travel restrictions. I think those travel restrictions should be better applied, more consistent, and certainly sending a clear message to the travelers and to the industry so that everybody can plan properly.
It seems like in the past year, while we've tried to resume life during the age of COVID, one of the key themes has been confusion. And, if the goal is to reduce COVID cases, particularly ones involving the new variants, why just target Mexico and the Caribbean and not restrict travel to the US, which has been hit with COVID and where a lot of Canadians have second homes? Kelly, I'll start with you.
Yes, I think this is a great example of the inconsistency that we're already, talking about. It makes no sense to target specific destinations when the new variants are circulating globally. So really, it's about restricting all non-essential travel from everywhere and screening, quarantine, and testing everyone that comes in. That's the gold standard that other countries have followed. And what we're
Countries
seeing
like where?
with countries like, Vietnam, Thailand, Australia, New Zealand, I could go on. There's a dozen countries that have effectively used travel-related measures in ways that enable people that come in, we know they're safe or they will be safe, and that everyone inside the border remains safe. So that there's clear examples of that where we're not seeing that in this country.
And Frédéric?
Well, I agree as well. I think those destinations were unfairly treated, especially in light of the very high traffic that continues to go between the United States and Canada, not only by air, but also by car.
Do you think, though, that if someone is going to travel, they will find a way to travel?
I think people can find a way to travel. As we know, some people are already talking about going to some of those sun destinations by going through the United States and then flying out of Buffalo, if you're near Toronto, for example. So there are different ways. But all those measures were taken to deter travel, to prevent travel. So I agree with my colleagues that it's not very consistent. I don't think it's the best way to do it, but it will have an impact nonetheless on people's intention to travel. And another impact it will have also, which I find is too bad, is that we continue to demonize the travel industry and thinking that it's one of the main reasons for the spread of the virus.
That's an interesting word to use. Are you saying that the travel industry is being unfairly targeted?
What we find, and I will be citing a study conducted by Tourism HR Canada, is that Canadians have increasingly negative perceptions of the travel sector. And even people who work in travel and tourism would not recommend to anyone else right now that they work in the sector in the future, which is concerning when we think about a future rebound of the sector. So yes, I think the travel and tourism sector has been targeted specifically, maybe unfairly. We have seen more measures, such as the travel ban, for example, instead of focusing more on testing and tracing in our own communities, which to my opinion, we have not done enough.
And Dr. Paul, I want to ask you that same question. Why just target Mexico and the Caribbean and not restrict travel to the U.S.?
I asked myself the same question when that restriction was made, that this is sun destinations. And so I do believe that there's an equal risk for people traveling to the United States as it is for Mexico and others. So I would think of an international ban rather than just a targeted ban. So I didn't make sense to me. And so I agree with my colleagues as well that it should have been a more far-reaching or international type of ban, because what we're trying to do is not to try to demonize anybody. Mm-hmm. What we're trying to say is, mobility equals travel equals opportunity for the virus to travel, and that's all we're saying. And this is an unprecedented time, so it's not about demonizing or trying to restrict people's rights and so on. It really is about the fact that we do know that as people become more mobile, particularly now with international travel, these viruses can travel very quickly. And so this is what our concern now, and it's even more amplified by this variant, these variants of concern.
The Prime Minister mentioned that Canada has some of the strictest restrictions on travel. Is that true?
Well, from our research, and we've compared the use of travel measures across all countries during this pandemic, Canada sits maybe somewhere in the middle. If we think about timing, countries were beginning to act as early as December 31st. And 80 countries actually imposed travel restrictions by end of February. So we went in mid-March, so we weren't the early adopters. We also often hear that we have closed borders and travel bans. In reality, the land border has been open to essential travel, of course. It's non-nationals and non-permanent residents that cannot come in for non-essential travel. Canadians are traveling for non-essential reasons. And this whole idea of essential versus non-essential is a little bit woolly. We don't have hard and fast definitions. And then we have no systematic testing of travelers coming in by land, air, and sea. It's just come in January 6th. There's some limited testing. And we have an honor system for quarantine. So compared to many other countries, Canada is certainly not among the strictest. And to be fair, we've had some stricter policies in the US and the UK, but I guess that's not really saying much.
And I guess part of this is the buy-in from Canadians, and polls show an overwhelming support for travel restrictions, Frédéric. Does that surprise you?
It does not surprise me. I think people have to be careful. They're concerned about their health and the community health. So, but again, I think that a lot of focus has been done on travel as opposed to focusing on community spread. And I found it interesting. Yesterday, some Harvard professor came out with a study to make recommendations specifically about air travel, and they propose all kinds of layered approach, basically, to mitigate the risk. But they were short of forbidding travel or recommending that travel would be suppressed. So I think there are some measures that can be taken, stronger measures that can be taken in testing, in tracing, in protecting, in behaviors, and still allow some economic activity that is related to travel. That you have to admit it's needed for the economic ongoing activity of the country.
And correct me if I'm wrong, I think what I read, the percentage of COVID through air travel is something like 2%.
That's what has been said. Now, whether it's a reliable figure, I do not know. Now we're requesting tests, to be taken for international travel before traveling, 72 hours, PCR test. Now there is testing on arrival in Ontario. So quarantine, of course, is being used as well. So to me, those are behavioral measures that should suffice to control the virus if they are applied properly and uniformly.
And Kelly?
Yeah, the problem with that 2% figure, it's only counting a subset of total travelers, and it's a very limited system of testing and tracking travel-related infections. So we're catching largely air travelers, and only if they are symptomatic and they come forward with a test and if they declare their travel history. So those are a lot of ifs. A lot of people get through the system. They may not be symptomatic. They may not declare. They might take a connecting flight in a domestic flight. And we're not counting anyone who's possibly exposed during the journey. So that means flight crew, taxi drivers, airport security. None of them are counted, and yet they are travel-related infections. So, if we're not counting the full number, we're not really getting the real risk measured.
Well, there have been concerns raised over the federal government's travel restrictions, particularly the measure that forces people to pay $2,000 to quarantine at a hotel. Kara Zwiebel of the Canadian Civil Liberties Association wrote a letter to the Minister of Transport and the Attorney General of Canada, which reads in part, "The quarantine rules will almost certainly impact those who travel to care for ill relatives or attend funerals, those who travel to receive specialized medical care, and those who have health conditions that will make isolating in a hotel a particularly challenging and potentially dangerous proposition. For these individuals, travel is not a luxury. As we have seen throughout this pandemic, the burden of both disease and public health regulation is now borne equally by all segments of society. Do not further disadvantage individuals whose circumstances require them to travel, particularly if they are willing and able to isolate at home." Dr. Paul, what would you say to critics who argue these measures unfairly target poor people?
First of all, my main comment is that this whole pandemic has unfairly targeted poor individuals and people who are disadvantaged in low socioeconomic status and so on. So this measure, I do recognize that it can disproportionately affect individuals who are cited in this letter. I think it's a deterrent for others to travel, obviously. I would obviously want to think that we'd be in a position, and this is a federal jurisdiction, not a provincial one, but I would like to think that people in those situations can get due exemptions from this. I would think that I would hope they'd be open to that. If, for example, that happened in my jurisdiction and I had to give an exemption in that regard, I think I would. I think out of compassion and out of understanding of the seriousness of these issues. But I think in general, it's not meant to target these individuals disproportionately, but it is meant to deter travel, obviously. And as with all public measures and what we've seen with the pandemic, we do have to look at this through an equity lens. So what they're saying in this letter is let's look at these regulations through the equity lens. And personally, if I were to make the decision locally, I would grant an exemption, under those unusual circumstances, ensuring that individuals, go through the proper quarantine and isolation protocols and so on.
I want to put you on the spot for a moment because I think some people will be saying, I've been at home doing all the right things. I'm not traveling. And now if I do need to do something in an emergency, I'm not allowed to do it. Do you worry that it's been a year for the pandemic, which is hard to imagine? Do you worry that we're focusing on the wrong thing, that maybe it's the messaging, so we don't need to have these rules in place if we do get the message to people to stay at home because for the good of everybody else?
Well, yes, actually, they're trying to get the message out by deterrent, obviously. And of course, my message and our message of my colleagues across Ontario and across Canada who are public health officers really is please avoid unnecessary travel. Stay at home as much as you can. As you correctly said, we're now almost a year into the pandemic. People are fatigued, but people should also understand that we are taking these public health measures during these unprecedented times. And of course, the messaging is stay home, stay safe. We've been trying to say that, and I think these are the other deterrents that are being put there by the federal government are to ensure that in case the message doesn't go through, there is some kind of a consequence. Again, my preference is education all the time, messaging all the time, but there are, and in public health, we have that fine balance between enforcement, regulation, and education. And I prefer more the educational messaging point of view, but sometimes you need these deterrents. But like I said, there is a reason for these things. Mobility of a person equals mobility of the virus. And now with the variant in play, it becomes a bigger challenge to us.
And speaking of mobility, there have been reports of snowbirds finding loopholes to avoid quarantine costs by driving back to the country. Frederic, I think you mentioned that earlier. And the government announced this week it's introducing testing at the land borders for these travelers. Is that enough, Dr. Paul?
I think it's a good step. I had read about people trying to find loopholes, and I'm really pleading to people, please do not look for loopholes. It's only a matter of time. The pandemic's going to go away. I don't understand why people look for these loopholes. But going back to that, yeah, I do think it's something that we had to address. People would fly into Buffalo and get their cars there and drive back to avoid all these things. But now I think those are stricter, and I don't understand why sometimes the government wouldn't have the same approach. You're still coming from outside of the country, where you'd have the same approach. Either you land by air or by car.
And Frederic, I see you nodding.
Yeah, I agree. I mean, we're going back to what we said earlier in the show. It's all a matter of consistency. We certainly would like to see the same measures apply to everyone, and those measures have to be respectful of the reason why people travel as well. So you talk about people who are disadvantaged, people who may have good reason to travel. It's a fine definitions about what is non-essential, what is essential, but I think that could be refined. And the government could certainly help us better understand the situation.
And Dr. Paul, with parts of the province reopening this week, medical officers in different regions have been trying to discourage intra-provincial travel that's within the provinces. Can you give us some examples of how the green zones will be trying to keep people from big cities like Toronto out?
Well, the most important thing is messaging. Really, we're trying to get the message across that, whatever zone you're in, you end up in, you should stay within that zone. We try to talk about that with our colleagues. We talk about it when we discuss this with the ministry and our concerns about interregional travel. We're not in a position to impose these. I know that some of my colleagues and what I've heard is some areas where, for example, people are coming from sort of hot zones into other areas with lower incidence. Businesses are starting to ask for identification to ensure they're coming from that area. I know that other health units are putting some other orders to sort of decrease the number of people going into a restaurant, those type of things. So I know that we've discussed that with my colleagues. We're not in a position to force these interregional travels, but we're trying again to discourage people from doing so. It is a fine balance between trying to find that right message and that right approach to be able to dissuade people from traveling from one place to another. But it is a challenge to us. But again, most of the individuals that we talk to do understand, and I hope that with our increasing messaging and the fact that now we have other factors in play, that people can understand that they should stay within their zone. And we do understand there's a discrepancy between certain areas. Certain areas, for example, the GTA is a hot zone, whereas other areas, as you go more east in Ontario along the 401, they're not as restrictive. And so we try as much as possible. I know that some of my colleagues are concerned about it. We message as much as we can. We're not at the point that we want to absolutely order this. It's not it's nothing that we want to do. We'd like to, again, use the approach, well, we'd like to reason with people and explain why why we're asking for these measures,
And what
and
is
we're trying to ask for people's collaboration. Sorry.
and not to interrupt you, because I think some
Yes.
people, I think one of the concerns is that this might lead to a situation where there's divisiveness and an us versus them situation.
Yeah.
What message would you like to say as to the why people shouldn't be coming into those regions?
Yeah. Well, first of all, I do agree that it can cause divisiveness and anxiety among people, obviously, which is an unwanted consequences of this thing. What we're trying to explain to people is that we'd like the people not to move from one place to another, from one region to another, just because we want to collectively do an effort to be able to prevent this virus from coming back into a third wave, fearing that it might be an even worse wave, and essentially we want to save lives. Every case that increases in Ontario increases the chance of somebody being hospitalized and an elderly individual dying. And so we want to have a collective effort, and part of our collective effort, which we've been talking about, physical distancing, masking, not going to work when you're sick, and so on, and all the other public health measures includes right now, and importantly, stay home, stay safe, and don't travel unless it's absolutely necessary.
And Kelly, we touched on this a little bit earlier, but do you think that the measures that other places like Australia have used to curb domestic travel, do you think that that would work in Canada?
There are some measures that will work. I know a lot of people say that, Canada is not Australia, it's not a big island. I would compare Canada more to Thailand and Vietnam, which has land, air, and sea arrivals. And they've done very well with actually fewer resources. So there's a lot of use of hotels for quarantining, for example. It may or may not be paid by the traveler. There's a lot more screening and testing being done at all borders. And this is doable, but you have to act early. And I think that's what our research is showing, is that we need to act earlier
So are
in
we too
order
late?
to get on top of it. We are probably the first wave for sure, but these new variants, I still think we're not too late. These new variants are like a new pandemic in many ways. We know that they are brought in by travel. They didn't swim here by themselves. So these new variants are, circulating in the U.S. in particular, and we have 33 states now announcing cases, including Florida, which has the largest number of cases. So there's a window of opportunity for Canada to be more vigilant, to ensure that all travelers that come in are either not carrying the virus or are quarantining. And we're still not doing that. And I think if we followed the other countries' examples, we could really prevent a lot of hardship later on.
Well, not everyone is convinced that travel bans are the way to go. American virologist Angela Rasmussen is with the Georgetown Center for Global Health Science and Security, which is in Washington, D.C. Here's what she had to say in The Guardian on December 23rd. She writes, "Rather than harsh and largely ineffective travel bans, we should instead focus on encouraging compliance with proven interventions such as masking, distancing, avoiding crowds and enclosed spaces, avoiding gathering outside of one's household or quarantine pod, and practicing good hand hygiene. By emphasizing the additive nature of risk reduction, transmission can be reduced in a way that empowers people with the information to make good decisions to protect themselves and their families." Frédéric, I'd like to start with you, but I want to ask all of you this question. What would you say to those like this virologist who believes, quote, imposing onerous travel restrictions alone is unlikely to make a significant impact in the overall pandemic? Frédéric?
Well, first of all, I think the airlines, the travel sector has done tremendous efforts to protect passengers and to protect employees. They have been the first one to implement safe practice, PPEs and all kinds of different elements, to processes, to protect travelers. And I think indeed that banning travel is the wrong message to send. I think we can still travel. We should, however, be paying more attention to our own behaviors, and that is what is really important. So the main barriers are going to be physical distancing, masking, cleaning, washing, testing, tracing. Those are the distances that I think will make a difference. So I do agree with Professor Rasmussen, and it goes in the sense of the Harvard study that was released yesterday about implementing all kind of risk mitigating measures without banning travel.
And Kelly?
Yeah, and I think, nobody's calling for a ban on travel, and sometimes travel restrictions are not appropriate. And you have, for example, a lot of virus circulating in your jurisdiction. And if you implement strict travel measures, you might actually be, putting your limited resources in the wrong place. So I agree, and it has to be a joined up strategy. But the way I look at it is you can draw an analogy with battle strategy. So where do you want to draw the line of battle? If it's at the national border, then that's, if you're in a situation where you have low infections and out there are a lot of infections, the battle line could be your national border. But if you don't draw the line there, it gets downloaded to the provincial level in our case. And if the provinces don't do anything, it becomes a community problem. And it's quite unfair to expect, everyday Canadians to battle these new variants through hand washing and masks. That we know these new variants are very transmissible and that you can do the normal things, and there's evidence to show actually that's not enough. So it's, where does the responsibility lie? Where are we going to draw these battle lines? And, it all comes down to good surveillance data and about understanding how these new variants are behaving. And they are looking like they're behaving quite differently, and we need a different strategy, which should include travel restrictions, but that's not all we do. So it's a package of measures we need.
And Dr. Paul?
It's as if I wrote that letter, actually.
Mm-hmm.
I would say the same thing, except that I would layer it. When we talk about, the multiple layers of protection, for example, in schools, we have multiple layers of protection. And so in the community and at large, so you start, as Kelly said, community, province, and then nationally, we have those multiple layers. And I think restrictions and travel restrictions or control or deterrence are part of it. But again, it goes down to, as you bring it into closer to your hometown, it goes down to really those measures that the virologist talked about, which are really masking, distancing, washing our hands, and so on. So it's the layered approach. So it's not just one, it's all of these together working synchronously and collectively to be able to achieve the goal, which is really to decrease the burden and transmission of the coronavirus, the COVID-19, and in particular right now with the new variants.
In our last minute, I'd like to ask the last question to Kelly. What measures do you think need to be in place to more effectively curb the spread of COVID and the new variants?
So overall, I think we're back to where we started. We need a coherent strategy, and that needs coordination across the federal and provincial governments and probably at the local level as well. We know that travel and COVID are intimately connected. So we need to move now on these new variants because they'll scupper a lot of the work that we've already done. So I would start by clarifying very clearly what essential and non-essential travel is. We need to get non-essential down to hopefully zero or very near to zero. So that reduces the burden on border management. And then we, up the screening, testing, and quarantine of essential travel or any travel that's left over. If people cannot quarantine, such as truck drivers, flight crews, they need to be vaccinated with priorities because they can only do their jobs by moving around. And the rest of us, we do continue to do what we do. We need better data, and we need to use that data to manage this new risk. So overall, again, we need this coherent strategy, and that's not what we're seeing at the moment.
Well, I want to thank all of you for taking the time to speak to us tonight. We really appreciate your insights and wishing you a very happy Family Day weekend. I hope you get some rest. Thank you.
Thank you very
Thank you.
much.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.